And we interrupt right now for some breaking news, pandemic update from Madison County.
Let's go ahead and listen in as they get started.
Agencies will bring you this weekly briefing on our community's response to COVID-19. Our speakers today will be Dr. Karen Landers from the Alabama Department of Public Health and Michelle Jordan, Executive Director of Top of Alabama Regional Council of Governments. You will note that we are sitting at least 6 feet apart according to CDC guidelines, as well as our own best practices to separate and sanitize. At this point, I'll go over the current numbers. In the state of Alabama, there are 389,772 confirmed cases of COVID-19. In Madison County, there are 28,413 confirmed cases, having resulted in 363 confirmed deaths in Madison County. We continue to monitor this and respond accordingly. At this point, we'll go to our first speaker, Dr. Karen Landers from the Alabama Department of Public Health.
Thank you, Jeff, and thank you for the opportunity to come back to Madison County and speak. It's been a few weeks since I've been over here, but obviously, as I work for the State Health Department, I keep involved in what's going on in 67 counties in our state, although Jefferson and Mobile, of course, are separate entities, but we coordinate with them. So I'm pleased to be back in Madison County today and talk about the ongoing public health efforts in this pandemic. Well, as everyone knows, it's been over a year. Some people say it's been almost a year, but when we look back at some of the planning that we did in Madison County prior to the actual appearance of cases in the state of Alabama, and we were working on this in the early part of 2020. So Jeff talked about the numbers today, and what I would really like to talk about today is the development that's on everyone's mind, and that is vaccines and where we're going with vaccines and how that is continuing. And first of all, let me say that we have certainly received a lot of attention at state, throughout the state, as well as nationally regarding our vaccine rollout. Certainly our trajectory might have been a little slower than some other states, but when we look at our allocation and we look at the targeted populations and we look at where we are in terms of data, we actually have pulled ahead of several states, and we believe that we are on the right trajectory with our vaccine administration in Alabama. Certainly, everyone who wants vaccine is not able to receive it yet because we literally do not have the supply in the state of Alabama. And before I get to numbers, I want to speak a little bit about what the difference is between allocation and distribution. Alabama is allocated a certain amount of vaccine, and of course initially obviously we're looking at population and specifically healthcare providers, first responders, the very large group of people that were rendering care to cases of COVID-19. And then we expanded our allocation plan past that into what we call our Phase 1B, which includes police, firefighters, critical infrastructure workers as defined by Homeland Security. Just for interest, again, teachers are actually in that category as well as other educational personnel. And we pulled up the category of 65 and above from the Phase 1C. Again, this was information from the Advisory Committee on Immunization Practices, so that we are now engaged in vaccinating an eligible group of about 1.6 million people. And until this week, we only had one type of product. We had two products, but one type of product. That's the messenger RNA vaccine. Now the J&J vaccine, which is a replication incompetent adenovirus vaccine, has been approved. So I want to talk again about the difference between allocation and distribution. Again, we're allocated a certain number of doses from which we can draw. But as far as distribution, the distribution is what we actually receive in the state of Alabama and what we actually have in the state of Alabama. And a lot of discussion early on was, well, you're sitting on doses. No, we're not sitting on doses, but when we order doses for a second dose, we have to give those as a second dose. And I will say that Alabama has not suffered the fate of some other states where second doses were actually inadvertently used as first doses, and now they're trying to get second doses to patients. We had a few of those episodes in the state of Alabama with some of our providers inadvertently, but we are working to ensure that everyone gets a second dose of vaccine. So again, our commitment has been to give this vaccine according to the emergency use authorization authorization, which is a 2-dose vaccine. Now, we did have to delay second doses due to the inclement weather a couple of weeks ago, and we worked extended hours last week as well as picking up weekend visits, so we were able to do some catch-up work, and again, extending the vaccine second dose past the 21 to 28 day interval has not been reported to interfere with efficacy of the vaccine. Certainly we'd like to give it as quickly as we could related to the minimum interval, but certainly up to 42 days or even longer, can be done if necessary, and again, we have exercised that option in order to get caught up with what is going on and what has gone on with the weather. We did have a weather delay in terms of shipment of vaccine to the state of Alabama, and the obvious reason for that, especially in North Alabama, is a lot of our vaccine came out of Memphis, and Memphis actually had quite severe weather, and the FedEx hub there was unable to deliver vaccine to us. But we have caught up, and we're now receiving the distribution that is expected in the state of Alabama. Going forward, looking at the distribution of vaccine in the state of Alabama, again, we are receiving our fair share from the federal government. I've had people ask about that, but we're like every other state. We'd like to have more. But we are receiving our fair share. We are ensuring that every county in the state of Alabama has a footprint for COVID vaccine. We've had that from the very beginning. We have 67 counties in Alabama. One county does not have a county health department, but we have ensured that that county received vaccine and had a provision of vaccine to its citizens. And in addition to looking at that, Alabama is also looking at the Social Vulnerability Index, which takes in a number of factors. For those of you in the media, we do have a daily media update that is sent out that gives more information on the Social Vulnerability Index. So you can see that we want to ensure that some of our extremely small counties in the state of Alabama or more vulnerable populations receive access and attention to the vaccine. Overall numbers as of yesterday, our vaccine dashboard had not updated prior to my coming here today. Alabama had administered 972,549 doses of COVID-19 vaccine. And of that group, 333,825 persons have received 2 doses of vaccine. Now, again, we're talking about Madison County, but again, as we were just discussing a moment ago, many persons come into Madison County from other counties in the state of Alabama, so we really have to look at what happens regionally. But when we look at what the administration has been just within this county, Madison County is number 3 in the state in terms of numbers of doses of vaccine given. That's not terribly surprising given the population of Madison, but also given the extremely strong partnerships in this community with the local hospitals here that have done a wonderful job in working with the Alabama Department of Public Health on distribution of vaccine. Madison County has just over 15%, this is a preliminary number from yesterday, just over 15% of persons in the county have received a dose of COVID-19 vaccine. Again, this is preliminary information, as even while we are speaking now, there is the ongoing second vaccine clinic here in Madison County for persons who received vaccine at the Mass Clinic. Now, in terms of where we go from here, before I speak about J&J, let me just say that we currently have enrolled in the state of Alabama 1,147 providers in our electronic registry, our imprint system. Entities have to be enrolled in imprint in order to administer vaccine, because we have to document the doses to the patients, and we also have to document every dose back to the federal government that we have given that, so that we can receive credit for our second dose. So that is a very, very important aspect of this, is ensuring that we have an electronic registry for this, and that our registry is called imprint. As far as retail pharmacy providers, we are very pleased that Walmart has come on board as a federal retail pharmacy provider, and CVS has also come on board as federal retail pharmacy provider. And really, the most important aspect of having the retail pharmacy providers, in addition to providing options for patients, is also that the retail pharmacy program brings additional vaccine that does not come out of our state allocation. So I think that's good. They bring extra vaccine, albeit a small amount of vaccine. You know, Walmart initially was getting about 15,000 doses. That's not a huge amount, and that's statewide. But again, they are bringing another element to the vaccine administration picture, and we're very pleased that they're on board. In addition, we know that some local pharmacies have been involved in vaccine administration, and other local pharmacies are signed up to get vaccines. So again, our weekly allocation had gone up to about 70+ thousand, and then up to probably closer to 90,000. Now, I tell people don't get excited about the fact that our allocation this week was 140,000, because that included the 40,100 doses of Johnson & Johnson that came to the state of Alabama. I want to mention Johnson & Johnson in terms of what we are planning to do with this vaccine. We do not have any Johnson & Johnson in the state of Alabama as of today, but we are in the process of getting that vaccine distributed to our state. 40,100 doses. What we plan to do with this vaccine is to provide this to entities who are enrolled in Imprint but have not previously been vaccine providers. As a physician myself, I generally prefer not to mix products, and by that I mean we're not mixing them together, but rather if we have an entity that has been providing Pfizer and they're accustomed to providing Pfizer and they're accustomed to that documentation, then we prefer that they stay with that product. Same thing with Moderna. We use Moderna at the health department. You know, we're accustomed to handling that product. We're accustomed to the documentation, the appointment system, and so we are going to stick with Moderna at the health department. Now, in terms of the J&J, again, that will be provided to entities who have not been vaccinators. So that will give additional vaccinators in the state. However, again, 40,100 doses is all we have been told we're going to get at the moment. We do expect some more likely at the end of March, but 40,100 is all that we can count on. Now, in talking about the J&J vaccine, there are some slight differences as opposed to the mRNA products, again, Pfizer and Moderna, that are very similar. As you know, those are two-dose products, and they have to be given depending on the minimum interval. The J&J vaccine is a single dose, as everyone knows from reading that in the media. The efficacy of the J&J vaccine has been reported around 72% or so, but if you look at the data in terms of the persons that were mildly to severely ill or even hospitalized and unfortunately had death to occur, if you look at the J&J data, actually it was very efficacious in preventing moderate to severe illness and also death. So the J&J vaccine is a fine vaccine. It is a vaccine that the overall efficacy, while it appears a little lower, is still very, very reasonable. And it is, again, it is an inactivated vaccine. It is a, again, replication incompetent adenovirus. This vector has been used to develop other vaccines in the world, including an Ebola vaccine. It has been tested in a broad and diverse population, actually, not in this country, but in other countries in the world. Adenovirus vaccines have been tested in pregnant women, and so, you know, we feel confident in the vaccine. People have asked me, which one would you take? Well, I already took Moderna, so I had 2 doses of Moderna, so I'm not a candidate. One of my family members took Moderna because they're a physician, so obviously they're eligible for the vaccine early in the phase. I tell people, take the vaccine that is available to you when your phase is available. Again, if you are eligible and you are offered Johnson & Johnson, take Johnson & Johnson. If you are eligible and you are offered Moderna, take that one. Same with Pfizer. Take the vaccine that you're eligible to take at the time. Again, it is a fine vaccine. We had a very good conversation yesterday on the science of the vaccine, and I feel that it is going to be an asset, but unfortunately we don't have much of it right now, and again, we don't know how long it's going to be before we receive additional product. So right now, the factor that is limiting our going to additional phases, and I get asked about this all the time because as a physician, I've been involved in the management of COVID patients myself with the uninsured, underinsured, and I would certainly like to see additional groups be included in the allocation that we are able to address. But right now, still the factor remains that we do not have enough supply to move from vaccinating 1.6 million people, for the most part, twice, unless we get more J&J. So we really are not able to pick up an additional group at this moment. All that being said, we work daily, day in and day out, to get the vaccine out that we have in the state of Alabama through multiple providers. We have over 400 Moderna providers in the state, over 27 Pfizer providers in the state, and now with the J&J we will have a few more. So we want to get this vaccine out, but at this point in time we're not able to expand the allocation phases, although I do hope that as more product becomes available we will be able to do that, because it's very, very important from the medical standpoint, very important to me as a physician, and so we hope that that will be coming, but again, keeping in mind that most of our product still has to be two-dose product, and we're not receiving a significantly higher allocation. You hear a lot on the national media about extra millions of doses being available, in the later spring, early summer. Again, we certainly are anxious for that to happen, and as that moves forward, then we will certainly address that. So, Jeff, that's really all I had about vaccine. I'll turn it back over to you. Thank you.
Thank you, Dr. Landers. And now we'll go to Michelle Jordan from TARCOG.
Well, thank you, Jeff. Thank you, Dr. Landers. What an insightful update. Good afternoon. I'm Michelle Jordan with the Top of Alabama Regional Council of Governments, and we've been busy working with our partners throughout our 5-county region and the state of Alabama over the last year, ensuring that all communities and citizens have what they need to weather the impacts of the pandemic. TARCOG does several things, but one thing that we're noted for is our services to seniors throughout our 5-county region. And as a result, I thought I'd share some information about services for seniors throughout the Huntsville, Madison County footprint, as well as DeKalb, Jackson, Limestone, and Marshall counties. The Alabama Department of Senior Services, led by Commissioner Gene Brown, has been working with a small group to develop a strategy for reopening senior centers throughout the state. As you might know, senior centers have been closed since last March, and the Department of Senior Services is eager to reopen these centers as soon as possible in the safest manner possible. Even though the 35 senior centers throughout our region have been closed, they have continued to serve 1,500 meals a day, approximately half of which have been in Huntsville, Madison County. And on top of that, they've figured out a way to still connect with our seniors through virtual exercise classes to keep that population engaged and healthy throughout the pandemic. TARCOG has also helped facilitate the USDA Farms to Family Food Box program locally with ADSS, and funded the grocery bag program with funds we received from the state to assist our partners in hand-delivering pantry-worthy items and meals to seniors in both rural parts of the region and urban parts of the region. You know, sometimes there's a high-rise senior complex that might have a need for those seniors might have a need for additional food items. We've been able to fund those grocery bag programs and are proud of it. This program not only helped alleviate isolation, but it also allowed volunteers to be able to determine unmet needs as they went and visited with families during those deliveries. Throughout the pandemic, I'm proud to report that TARCOG still was able to offer all of our other services throughout our region to our clients, specifically our legal services for seniors and our Medicare open enrollment counseling services. Even though we had to stop all face-to-face in-person meetings, our staff attorney was still able to serve 822 seniors throughout the pandemic, We went back to the old-fashioned way of connecting with our clients by phone and by using the mail, but we were able to connect with them, and really proud that we were still able to prepare powers of attorney, advance directives, and wills at no cost to seniors. Our Medicare counselors also were able to assist clients with their health care options, and we served hundreds of clients this year. We always serve hundreds. We were concerned that that number might go down in the midst of the pandemic, but are proud to say that we still had record-setting numbers this past year. We've also been working really hard to get the word out to our seniors about the importance of getting vaccinated, and we've been assisting this most deserving population with locating vaccine sites in their cities and counties. One thing that will start soon is when those home meals are delivered to the 1,500 seniors per day, it'll have a sticker on the box letting seniors know how they can set up appointments for getting vaccinated. TARCOG also has been working with our partners, our cities and counties throughout the region over the past year with economic development activities. We've been working with the Alabama Department of Economic and Community Affairs, ADECA, as many people refer to the agency as, and the U.S. Economic Development Administration, or EDA, and HUD. We've all been busy during the pandemic. TARCOG is in the process of helping several of our counties apply for COVID response and recovery funds to meet COVID-related challenges throughout the region. And these funds are coming from our federal partners. In Madison County, we're working with Chairman Del Strong to find ways to potentially fund a mobile telehealth unit that could respond to health-related needs throughout Madison County, as well as looking at ways to fund the medical equipment and PPE needs of our volunteer fire departments and other entities assisting those with COVID-related illness. We've been looking also for funding for food distribution partners throughout Madison County, agencies that have really alleviated that need among our citizenry. And we're excited about meeting the food insecurity needs. Many of us have been moved by the lines of cars and people waiting for food. We hope that the funding that we're working to secure for Madison County will meet those needs as well. We're also working with some of our counties throughout the region to create loan and grant programs for small businesses experiencing COVID-related challenges. And we're exploring grant opportunities that will further strengthen our resiliency. As we know, we're coming out of maybe some of our darkest days, but we want to make sure that we're prepared for any challenges that we continue to face. We believe that our region and state will be better prepared to withstand global emergencies like the one we've been in for the past year in the future, because of the way we've all come together to support and advocate for the citizens of Alabama. Thank you, Jeff.
Thank you, Michelle. Thank you, Michelle, and thank you for watching today. We'll be back here again next Wednesday, March 10th at noon for another briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please state your name and who you're affiliated with, and we'll allow one question and a follow-up.
Hi, Bridget Divers with Way 31 News. This question is for you, Dr. Landers. So with Texas and Mississippi, they have lifted their mask mandate and they're allowing restaurants, businesses to go back to full capacity. Could you see Alabama doing that anytime soon? And would that even be a good idea while cases, they might be low, they're not zero?
Well, of course, we give information to the governor related to public health, and we defer to the governor in terms of decisions related to the specific safer at home order, including the mask mandate. So I believe that it's very important for us to provide medical information and then allow her to make the decisions that are best for the state of Alabama. Thank you.
And with hospitalizations at some of their lowest since the early beginning of summer, how are you guys feeling knowing that we do have 10,000 people that have died over the past year, but do you see that we're possibly getting over the peak after all that holiday spike and all those deaths?
Well, obviously, as a physician and keeping in mind the numbers of colleagues that I have who work in hospital settings, intensive care units, emergency rooms, I am very, very happy that these hospital numbers have gone down. I mean, what a terrible time for these team members, hospital medical care workers, whether they're professionals involved in this or support personnel, to have gone through. I mean, I don't think any of us will ever forget this experience and trying to do all we can to save lives, but, you know, the tragic loss of 10,000 people to COVID-19 in the state of Alabama. I think what we're really looking at here, again, is the numbers are down, but we really need to keep our guard up. We have identified B117, which is the UK variant in the state of Alabama. Other variants can occur. You know, viruses can mutate. Every time a virus infects someone, it's an opportunity for that virus to mutate. So while the numbers are looking better, it is a time for us to remain vigilant and remain very, very aware that COVID-19 can spiral out of control. Again, we've seen it, we've lived it, and we want to do all we can as individuals as well as members of the community and professionals to get this virus under control. COVID-19 is not going away. This virus will find other ways, but we can get it under control with vaccination and with preventive measures. Thank you.
Thank you, Dr. Landers.
Brian Lawson, News 19 for Dr. Landers. Just quickly, a housekeeping thing. You mentioned the Johnson & Johnson vaccine would be given to providers who haven't otherwise had vaccines so far. How do people know to reach them? If you know, the health department has them, the hospitals have them, there's been other providers so far. These are essentially new providers. How would somebody sign up for that?
I'm sorry. First of all, you know that the provider makes his or her own appointments related to that entity. What we plan to do is once we have Johnson & Johnson in the state of Alabama and once we have providers who have actually received product, then those providers will go on our vaccine provider list, which is on our website under our vaccine dashboard. So those providers will go on our list as providers. Now, what I remind people is certainly you can call and speak with an entity about which product they have available, and you'll know which product you receive when you go to that entity or make your appointment. But we don't list the providers by product on our website. However, I do expect that we will add those additional providers as soon as they have product in hand. And I really do encourage people to not shop for a specific product, but when there are providers on the website within a county or close by, we don't restrict people in what county they go to get vaccine, to make an appointment with the provider and take the vaccine that provider has available. Thank you.
Just to follow up on that, I don't think I'm talking about somebody shopping. I'm talking about a new source for vaccinations that didn't exist today. How would somebody know the difference? Are you going to signal to the public that those folks now have vaccine?
Yes, again, we will add more providers to the list. So there will be more providers on the vaccine spreadsheet list that we have on our website as well as on our vaccine locator map. So again, I think it's very important, and also to within the community to make other providers aware. For example, the health department, we know how much vaccine we have available. If people call us, we don't have any appointments available, but we know that other entities do have that. So it's again, we have a spreadsheet on the website, and we also have our vaccine locator map on the website.
Last thing I've got, you mentioned earlier keeping our guard up. As was pointed out, some other states have gone a different direction as far as that goes. ADPH's role is to advise the governor about health implications, that kind of thing. Is keeping your guard up taking away the mask mandate, do you think?
Well, again, as far as making that decision, whether there's a mandate or not, persons can still certainly continue to wear masks. As a physician, I think masks are important. It's an important infection control measure. I've carried that out through my entire career. People have heard me say before I worked TB control, so, wearing a mask is not foreign to me. Also, there are times that my TB patients, I have to have them wear a mask, depending on, where they are in the course of their illness. And then other respiratory diseases, again, masks are very, very important in terms of infection control, not just for SARS-CoV-2. So I do think that masks play a role, but again, we'll defer to the governor on her decision related to that. Thank you.
Thank you.
At this point, we'll end the press conference. Thank you for coming.
And Dr. Karen Landers with the Alabama Department of Public Health kicked things off for us this afternoon. She noted while our vaccine rollout may have been slower than other states, the path Alabama's on and has stayed on is now pushing us ahead of other states. That was one of her top points she made this afternoon. She said Alabama has not suffered the fate of other states in terms of running out of second doses. She said just over 15% of people in Madison County have received at least one shot of a COVID vaccine. The addition of the retail pharmacies like Walmart and Walgreens and CVS really brings more doses to the state that do not pull from the state's allocated doses, so that's another good thing. She also mentioned no Johnson & Johnson vaccines are in the state just yet, but they are en route. Dr. Landers said the state health department doesn't want to split products up, so these new vaccines from Johnson & Johnson that arrive in the state will now go to other providers who are not currently providing the Pfizer or Moderna vaccines. Bottom line, Pat, she said, take the vaccine that's available to you whenever you're eligible to receive one. She says they are all fine vaccines. Don't wait for one or the other. When your number's up, you get an appointment. Just take whatever is available for you at your provider.
Marie, we also heard from Michelle Jordan, the Executive Director of TOP of Alabama Regional Council of Governments, or TARCOG. In case you don't know what that group, or you're not familiar with that group helps local governments improve the quality of life for residents. So in this case today, Michelle Jordan spoke about providing vital services to seniors all during this pandemic for the past year. And one of those priorities right now is working to reopen the 35 senior centers throughout our region. And they continue to serve meals every day to keep the population engaged in things like exercise classes as well. They are also involved in very important farms to families and grocery bag programs delivering food to seniors. Plus, they're determining the unmet needs of folks in communities that are in the need of those types of services and food and that sort of thing. So they're also helping to ensure seniors get vaccinated. To your point, Marie, that's all important for them as well. Of course, many of them in that high-risk category when it comes to COVID. So that wraps up another Madison County COVID response briefing. The next briefing comes your way next Wednesday, March 10th at noon. In the meantime, our next newscast comes your way at 4. We'll see you then.